My name is Fabian, and I'm here to talk about understanding safety and security from different perspectives within the community. For background, Age-Friendly Lowell is a program founded by Tufts Health Plan, which looks at all the socio and economic factors that affect an older adult's ability to lead a healthy, independent, and high-quality life as they age in place, with aging in place being defined as their ability to stay in their homes and neighborhoods as they get older. One of the 9 domains that are a focus point in Age-Friendly Lowell is safety and security, which has been identified as crucial for helping to prevent persistent feelings of stress, as well as making better health outcomes within older adults. And so the purpose of the study was to develop a framework to understand knowledge, attitudes, beliefs, barriers, and facilitators to safety and security within Lowell from perspectives of both the older residents and the frontline police officers working within the community, as they have been identified as the 2 major stakeholders. And so one of the methods used to help collect data from older adults are community surveys, which are given out at community events, and they include questions from all 9 domains of the Age-Friendly Lowell program, and they're intended to get results from the older adults themselves on their perspectives of safety, security, transportation, and all the other domains included. Focus groups were also held in order to see what older adults believed were their biggest concerns with safety and security, and these were performed in the South Commons apartment buildings in Lowell in order to get the word of mouth directly from older residents that are living in the community. And lastly, a literature review was performed with the purpose to identify what police officers believed were their biggest concerns with community policing, and preliminary data has found that lack of communication from community groups, poor funding, low support from frontline officers themselves, and a lack of time due to other obligations with the profession have all been named by officers as getting in the way of community policing. And so we've developed key informant interview questions designed to help interview the police officers of Lowell to help see what they believe are the biggest concerns with safety and security for older adults from the frontline officers' perspective. And so far what we've found is that the common concerns of the older adults are lack of security cameras, not feeling safe to walk alone at night, even when doing chores, and individuals loitering around and inside the property at night. Police inactivity was also mentioned, and as such we've devised that older adults may believe that improved communication and response from community officers can improve their outcomes of safety and security. And so we're going to take all the data that has been collected so far through community surveys, focus groups, and help frame questions to interview police officers themselves. That way we can create some common ground between the 2 groups and figure out what can be done to help improve the safety and security for older adults in Lowell. And I would like to thank my faculty mentor and project collaborators for their assistance on this program.